Hello, welcome to the Ultimate Men's Movement. I'm Jack Rocco, your host. We have a great guest this morning, Adrian Towson. She is an orthopedic surgeon out of Westchester, Pennsylvania, and she's going through an interesting transition that I can really empathize and sympathize with. I'm 100% behind her concepts as I understand them. So I want to introduce you to Dr. Towson and
Yes.
we're going to get going. So thank you for
Oh,
coming.
great. Oh, my pleasure. Thanks for having me. Yeah.
So tell me a little bit about your project. How your transition. So you've been an orthopedic surgeon for how
hmm
long? And tell us a
hmm
little bit about the transition you're going through that is similar to what I've been doing.
Yeah, sure. Absolutely. So I've been an orthopedic surgeon in Westchester, Pennsylvania for the past 21 years. So I've been originally from New Jersey, trained in Pennsylvania, in Philadelphia for my fellowship, out in Pittsburgh for my residency, and then came and settled not far from Philadelphia. I did a sports medicine fellowship. So for the past, 21 years, I've been in private, well, I should say for the past 19 years, I was in private practice. I took one job immediately out of fellowship. So that was back in 2004. From 2004 to 2006, I worked hospital employed for a couple years at a little small hospital out in sort of southern Chester County kind of country area here. And then I joined a practice in 2006. There was a private practice that I just left 6 months ago. So I was with that group, which was a group I loved and a community that I loved for 19 years, practicing again, primarily sports medicine, shoulder and knee, took call at our community hospital. So did, my fair share of fractures as well. But then we went through a private equity acquisition, and that changed a lot of things. That was a few years ago. So became a different practice, became a place that was really, not, it just wasn't sustainable. The values of the private equity company and didn't really align with my values. And I wasn't the only one who left, but I kind of reached my breaking point, and I left about 6 months ago.
Now,
So,
this is I've heard the private equity
mhm,
concept and how
mhm,
that's beginning to purchase some practices,
yeah,
but it's not something that I've actually experienced firsthand.
yeah,
Um, and I've gone more from the private practice into more hospital owned, and how things have changed with that. But can you elaborate a little bit on private equity and where these guys come from and what their interest is and how that's impacting not just your practice but across the nation?
Yeah, for sure. So, I mean, there's been, seemingly a fairly large influx, even though compared to like big health systems, I mean, it's still more the minority with the private equity situation, but not private equity is getting involved in, hospital acquisitions, health systems, and then into private practices as well. So, our kind of road into that was when I joined my practice back in 2006. It was a relatively small private practice. It was really ideal. I thought so then, and looking back on it now, you think so even more. But we are again probably about 30 minutes outside of Philadelphia, so not too far from being some bigger, having some bigger groups and health systems around. So we were growing, we were holding our own, we were doing fine, and then we ended up probably 5 or 6 years after I joined, becoming part of a super group that was emerging in our area. So that was kind of step one for us. I mean, that had nothing to do with private equity at the time, but it had to do with growth and just the whole mindset of you have to be bigger, you have to be bigger to compete in the marketplace, you have to be bigger to have more power, in theory, with insurance companies and so on and so forth. So it's that was just really the mindset, is like you just have to keep growing and you have to get bigger. And unfortunately we see that that's bigger is not always better. So we were part of then, but we did it. I mean, we felt like we had no choice at that time, really. We needed the advantage. So we were part of this super group that brought together many different practices in our region. So we were up to maybe about 75 physicians, mostly orthopedic surgeons. We had a few non-operative docs in the mix. About 13 different groups or so were together, and that it actually was okay. The big entity was still a private practice. We still did our day to day the way we wanted to, but once again, with that mindset of bigger is better, somewhere around 2019, the thought was we need to continue to grow. We've grown the group as much as we can with, the current like administrative, people we have, and we need to take on a private equity partner. So, I mean, sometimes I think, smaller groups are looking for, to be saved, that people are really struggling if they're trying to maintain private practice as a smaller entity, depending on the region. We weren't a small entity at this point, but once again, looking to grow in the marketplace still, and looking to kind of, let's say, quote unquote, dominate, because we have some big competitors in the area. The thought was the only way we can do this is someone that could potentially bring in more capital, bring in more infrastructure, bring in all of this kind of growth potential that we had kind of, let's say, maxed out what we could do with our resources. So
Mhm.
that's, I mean, again, I think much of the time it's they bring this promise of being able to put like an influx of some capital in, being able to, potentially, run things better. But the thing is, I mean, private equity companies are not, they're not healthcare people, I mean, so they, at least for the most part, I mean, they may have, consultants or other people that are part of the process, that claim to know what they're doing in the healthcare space. But as we can see time and time again, and our region's been affected with other institutions, hospital systems and whatnot that have closed at the hands of private equity. And what really happens much of the time is they come in, they claim they can do a lot for you, but they really have their own agenda. And so they're coming in and charging huge management fees, and making, their investors happy, and not really worrying so much about what's happening at the ground level with the physicians and the patients. And it's all about cost cutting, and getting, the maximum they can out of you, like trying to just increase the volume, get as much money, coming through the practice that can then get into their pocket, really.
Yeah. So how did that affect your day-to-day, your day-to-day practice and seeing patients, and but also, like as a private practice owner or corporation owner, you often have a say in what's going on. Were the physicians able to have representation with the private equity, and how did that affect your day-to-day life, or was it pretty much you're there flipping the burgers for them?
A- After a bit, we're flipping burgers for sure. I mean, in the beginning, through the like, process, the due diligence process, let's say on both sides, of trying to decide even whether or not to do the deal. I mean, again, a lot of promises are made, all the partners and shareholders, because we were all, partners in the large entity. So like everybody had a vote as far as, making the, decision in the first place to do the deal. And there was some skepticism even at the time prior to making the decision, but the majority, including myself, I voted for it. The things
Mhm.
that they say and what are kind of expecting, it actually sounds, pretty good. I mean, once again, it's a little bit of the unknown. Most of us physicians are not savvy business people so much, so it's also easy to kind of have the wool pull over your eyes, so to speak, and say, yeah, this all sounds great, and I don't know how it actually plays out, but I'm going to take your word for it. And we're usually pretty, I guess pretty naive, but not in a bad way. We try to believe people, like we, look for the best in
Yeah.
people for the most part. I think most physicians are, kind of genuinely good people. We set out to help people. That's our job, right? So
Mhm.
anyway, so then, once we get into it, in the beginning, you still kind of think that you're going to have a say. I mean, I mean, we still have a board, we have some committees, but now everything is now going through, the private equity firm and their executives and whatnot. So it then becomes like layer upon layer of, trying to get any question answered or any decision made. It's no longer made at our level. It's no longer made at the practice level. It's certainly no longer made at the divisional level, again, because we were this super group with many divisions. So before this, I mean, we could pretty much do our day to day the way we wanted. I mean, we had, another level above that, the administration of the super group, but it was relatively easy, and still relatively, it was all physician driven. And then once we got probably like a year in, the first year wasn't that much different, I have to say. But like beyond that, once we get into year two and year three, after this deal was done, then, we really had that sense we lost all control. Then it was, they acquired a second group 6 months after us that made our grand total of physicians about 90 or 95. They're trying to like centralize everything so that, again, we can be, looking at cost cutting, at reducing staff and whatnot where they could. And, we really felt like we had lost control. I mean, anything that would normally be a decision, whether it was about, hiring somebody or needing another staff member, or, trying to change some kind of like like supply or anything like that in the office day to day was no longer up to us. And everything, was corporate. Everything had to go through corporate. So, it became very miserable, actually, and then,
Yeah, and this is something that, as physicians,
yeah,
I mean, and especially, this concept didn't exist when I was coming out of residency, when you were
yeah,
coming out of
yeah, neither,
residency,
yeah.
even
Hmm.
the hospital base, the
Yeah,
percentage of private practice and individual owned practices was much higher. Um,
absolutely.
and you don't have any experience, you don't have any training, any preparation for this. And as I said, it's a thing that's evolving as we go.
Yeah,
So
yeah,
there's often those, the unintended consequences, whether it be hospital-owned practice, it's a similar thing.
absolutely.
Um, so again, I guess, from what I'm understanding, it just became, more and more difficult for you to have any, we hear all about, work-life balance and maintaining your mental health and
Yeah.
your own personal health.
Hmm.
And it sounds like that just became more and more of a struggle that was
Hmm.
not just financial, but also personal and
Yeah.
um, family, suddenly
Hmm.
you're there, they own you in a lot of ways, and especially as physicians, we're already pulled in 1,000 different directions when you're home and on your weekends and
Right.
vacation.
Mhm.
Um, and it just sounds like that was something that just became
Yeah.
intolerable for you, if
It
I'm
did. Yeah, no, for sure. I mean, the word I would use all the time is unsustainable. It just really did become that way. So, throughout year 2 and 3, again, we're just kind of being expected. We began struggling financially as the practice, and in large part because of the, exorbitant management fees that were leaving the group, on a monthly basis. The only answer we were generally given was you just have to, you have to work harder, you have to see more patients. And I will say, like, particularly my division, I mean, we prided ourselves. We were one of the bigger divisions within the super group. Just a great group of docs, honestly. Like, we worked really hard over the years. We had grown this practice. We were so careful with everybody we brought in. We had a great reputation in the community, and it was being tarnished by this. I mean, they tried to like centralize a lot of things, again, kind of cut the costs, and that include things like call centers, like schedule templates were, enforced, and you have to do this or that, and many of us had like 10-minute appointment slots, and my group already kind of maxed out what we could do. I mean, we all worked hard already, and so there's
and
only
yeah, I mean,
so much you can
orthopedic
do.
surgeons and yeah,
Yeah,
orthopedic surgeons in my experience,
yeah.
we
Hmm.
we tend to be, efficient people. We tend to
Yeah,
get to the point. For
right.
the most part, we enjoy our job. We
Yeah.
enjoy what we do. We enjoy patients. Um,
Yeah.
and you're right there's very little fat to trim as it is, but
Right. So
you can
we were
always find more, or someone can always find more.
try. So yeah, so we were being, we were really kind of under that gun, and it became, just it really became, like I said, unsustainable, and a job that I loved. And granted, like you're saying, I mean, we always work hard. I mean, I'm not, nobody's afraid of hard work. We're in this field, and we've done it since our years in training. But then also we were being extremely undervalued, and just not really respected for, who we are, what we do, and what we had built in this community, already, so we were, many of the physicians were at a point where we were making about half of what we used to make, honestly, for a couple years straight. I mean, there was so much money leaving the practice. We were not being able to do anything like extra in our group. Like, we, at points were on credit hold with some of our vendors. Like, the money was just like, we're like, what is going on here? This is just not possible for the, how hard we're working. And then, trying to do extra, we were all trying to, like, nose to the grindstone. But again, we were sort of already there before this happened.
Yeah. And it's
So,
already not just within the practice, but within healthcare.
yeah.
I can go back to when I was a resident,
Mhm.
and one of my best friends at the time, his father was an orthopedic surgeon, and I
Mhm.
would say now, 30 years later, your average orthopedic surgeon, not even like, you know, inflation adjusted, but physicians have repeatedly gotten pay cuts, pay cuts, pay cuts, and we literally make about 75%, like I said, dollar for dollar, not even corrected,
Mhm.
75%, 70% of what they used to make 20 or 30 years ago.
Yeah, it's
So you're
ridiculous.
right, that and
Mhm.
and at a time back in the day where they used to do, two or three procedures a
Right,
day, now we're doing
right.
6 or 8 or
Yeah,
9 or 10 or 12, or if you're
absolutely.
taking call and surgery center. So it really does. as we start to age as well. I mean, especially if you're doing trauma, some of this stuff that,
Yeah.
you're already,
Hmm.
you've been burning the candle for 20 years, you're
Yep.
getting a little older, your
Yep.
family dynamics change, everything, and you're expected to just crank it up a little more this year. Just keep
Yeah.
cranking a little more, a little more, a little more.
Yeah.
Um,
Yeah.
at a point where it just becomes unsustainable. So I really, I'm sorry you went through that.
Oh, thanks. Yeah.
And it's unfortunate that it becomes, pretty much expected.
Yeah.
It's
You're right.
almost, for a young orthopedist coming out in the market today,
Hmm.
they're coming in naive and
Hmm.
bright-eyed and bushy-tailed and
Yeah.
think they're going to conquer the world.
Mhm.
I'm not sure that this trend is ever going to change.
Yeah.
It's discouraging. So what are you doing now? This is the exciting part.
Yeah,
Like I said,
this
I'm
is the
sorry about all that. And it's,
no, it's good. And it's funny.
but it's like, what have you done to take back control of some of your life and,
Yeah.
your personal self, your
Yeah.
individuality?
Yeah, no, exactly. Yeah, I'm very happy to talk about that because now I'm kind of on the other side of it. And, it was, first of all, a very difficult decision to make. So when I finally decided I'd reached my breaking point, I mean, I knew it and I probably knew it 6 months prior to when I finally made the decision. But I'd been, again, with the practice for 19 years. And as bad as things were getting, I just felt a certain degree of, of just like loyalty and like guilt for thinking about leaving, and I'm like, this is my, community. These are my partners. And like, I was, becoming one of the more senior partners in the group at that point in my specific division and had been, I'm the only woman. And so I often was the one who was kind of looked to as like kind of when morale was low, like I was the one that like, hey, let's do like a little party or a theme day or something like that. Like I was the one who always tried to like keep things a little bit more upbeat. And I wasn't even able to do that anymore. And so, anyway, so when I made the decision to resign, it was after a weekend on call actually, and I had done I don't know how many hip fractures, and I'm like, I just volunteered my time all weekend based on what we were getting paid and all of that, and I just had kind of reached my breaking point, and so I made that decision. So I resigned in November of 2024. I stayed for 6 more months. I left in May, so I've now been gone for 6 months. And honestly, I left without a plan. I said, I just know I can't do this anymore. And I finally, again, just said, I'm miserable. I mean, I'm 54 years old now. Like, again, been doing this a long time, getting older, feeling even more tired, trying, not having the opportunity to like even try to work out the way I want to or do other things. I have grown kids and I'm actually single. So, I mean, luckily I wasn't like destroying relationships along the way, but I could
Mhm.
have been if my kids were still home or I had a husband here. Again, I was not a pleasant person to be around at the end of the day or, on
Yeah,
the
it's
weekend.
hard to.
So,
I mean, how
yeah,
can you? I mean, but of course,
yeah,
we always blame ourselves. I mean,
yeah.
I think, like,
Mhm.
I know personally, and we were trained, and I think we
Yeah,
also have that internal, you don't blame other people.
yeah,
You're proactive in your life, and things go wrong, and you constantly push it on everyone else. But at
mhm,
some point, you have to have some grace and some
yeah,
understanding of your own self,
yeah,
and
mhm,
that it isn't all your fault.
yeah.
But
So,
you finally took
yeah,
control, and
yeah.
that's empowering, if nothing else.
Yeah. So I did, and when I cried my eyes out on my last day of work, and thankfully, actually, one of my daughters I have two adult daughters. One of them happened to be home at the time, and she was super supportive, and it was very helpful. But and for the first week or two, I was kind of lost. I was like, I don't know, because I really, like I said, I left without a plan. There's a couple other guys from my division who also left, who are younger, and they went to other jobs. They had to, but we have a pretty significant non-compete, and so one guy moved to another state. One guy's now got like an hour and a half commute to work, and I left knowing what I didn't want to do. I'm like, I'm not doing any of those things. I'm not moving. I like where I live. I'm happy in my
Mhm.
community. I have a huge reputation, a huge patient population. I'm going to get back to it in some way, somehow. Like I'm not going to just walk away from all that. It's not fair, and even if I pivot into some other, I knew I wanted to still stay in healthcare and still try to help people and still try to like serve this patient population. Just didn't know
Mhm.
exactly what I was going to do. So I had been actually doing a lot of networking on LinkedIn. And that became like a great, kind of a safety net for me a little bit. I met a lot of wonderful people, started to, kind of brainstorm, get some, kind of other opportunities coming my way. But ultimately, what I landed on was opening more of like a wellness clinic. So doing something that would be, a little bit of a different pace for sure, but sort of align with what I had done in orthopedics. So I, was a sports medicine surgeon. That was my fellowship. So a lot of my patient population are the 40, 50, 60-year olds, as well as some younger athletes, high school, college athletes I took care of as well. But, people, really trying to maintain their health, maintain their mobility, maintain their, and their longevity. And so that's kind of the patient population I had already. So I'm like, there's other ways to do that other than me being the one that just has to come fix their rotator cuff or, their
Right.
ACL or whatever. So I really started diving into learning about, more of, let's say, like longevity medicine, functional medicine, hormone optimization, that type of thing. And the once I started to get into it and learn about it, I was just, I was hooked. I was like, this really is,
Yeah.
a part of medicine that of course we know about and we see, and I certainly wasn't the most aggressive surgeon on the block and tried like non-operative things with my patients all the time, but non-operative things in the like anti-inflammatories, steroid injections or visco or
Mhm.
whatever, PT, and that was kind of the extent of it. It wasn't that we were looking more at that kind of the whole person and other things that we could do, and kind of root causes and all the things that are so necessary to like look at, and I think also so much overlooked in large part because of lack of time, and just the way the system is, that a lot of people in specialties that see the aftermath of things like us seeing the fractures or the injuries, don't really have the opportunity to dive deeper in with the patients and really take good care of everybody, like more, more completely, let's say. So
Right.
yeah,
Especially if you're in a, if you're in a situation where you're expected to produce,
yeah,
as an
right.
orthopedic
Hmm.
surgeon, we
Hmm.
produce when we're operating.
Yeah,
But,
exactly.
the percentage of patients that are out there who have just these generalized aches and pains,
Mhm.
I
Yep,
used to always say, like, if you have something surgical,
yep,
usually you use your finger to point to where it is, like
right,
right here.
right. Yeah,
And you're
right.
like, okay, rotator cuff, okay,
Yeah,
biceps tendon.
yeah.
Um,
Mhm.
Whereas the patients who come in with their hand, they're like, my arm, my hip, it goes,
Uh-huh.
this
Yeah,
whole body pain.
right.
Um, and if you're seeing all those patients in the office,
Hmm.
especially if it's in a high production situation, you can't help those patients. They
Yeah.
don't pay,
Mhm.
as much. They don't reimburse as much as if you're doing surgery.
Right.
Um, and it often takes a lot of time.
Yep.
But that's where the key is. The
Mhm.
key comes in diet, comes in exercise, comes in, like you said, hormone optimization, all those things. So, I mean, I've found that transition to be
Yeah.
interesting,
Yeah.
but also rewarding, and more, becomes more personal, and it's a lot of the things that I need for myself as a
Thank
middle. It's
Really. Yeah.
if I needed a doctor, I'm the kind of doctor I would want to go to.
Hmm.
I don't want surgery. Most people don't want
Right.
surgery. But as
Right.
a surgeon, if you're a baker, you make bread. As a
Exactly.
surgeon, you do
Yeah.
surgery.
Hmm.
So you get stuck in that, like, hey, I can't help you, buddy.
Yeah.
Go see your family
Exactly.
doctor. But so
Right.
how's that been going for you?
Well, it's good. I mean, I'm in kind of in the process now. So,
Mhm.
I have an office space that is being renovated presently. So, the other thing, again, I wanted to stay in this area, and again, pivoting was great for numerous reasons. One, again, to allow me to do, something different, something I'm not gonna say better, but just different. I mean, again, we certainly serve a great purpose as an orthopedic surgeon too. But I think, and again, I needed to pivot and kind of do something differently so I didn't have to leave this area. And so I have an office space, close to where I live, close to where I used to work, that is,
Mhm.
presently being renovated, should be done by the end of the year, which is very exciting. And I've been, doing a lot of education to get all of the kind of, or as much as the information I can, and I know some of it'll still be learning as you go, and dealing with everybody as an individual, so that's also really exciting. But I've been loving it. I mean, I just got back this past weekend. I went down to Florida to a conference run by Vonda Wright, and it was a women's health conversation. So I don't plan to be only focusing on women, but to your point, as a midlife woman myself, recently going through menopause, menopause. And I remain very active. I do competitive ballroom dancing, and I have, very high aspirations of continuing to do this at a high level for a long time. So I very much ignored a lot of what was going on with me through menopause because it coincided exactly with all the stress of this private equity
Yeah,
debacle. And
which doesn't help matters. Stress is
so
horrible on top of all that.
Absolutely. So, I went through, despite being active and dancing and continuing with that schedule, gaining 20 pounds, not sleeping, feeling miserable. I'm like, what is going on? Like, this is not me, and so many times I have heard other, women or men, say, like, I just don't feel like myself. And, I mean, there's obviously ways to change that, but, some of it is from the person has to be like proactive and want to change it. Right. But I think so many
Mhm.
people are, and I think it's becoming so much more of a, let's say, not a trend, but I think there's more awareness of, things that you can do to try to, improve your health span, right? That's the term that's often used is, I mean, maybe we can do things that do truly improve lifespan and add some years to your life, but the quality of that time and being able to do the things you want to do, and feel good, so yeah, so some of what I was going through also, I'm like, as I learn more and as I'm like, yes, like I'm so mad at myself, but I understand why I didn't like kind of seek help or do something for myself sooner. I've done it since, and it's like it's amazing.
I'm sure you feel 100% better.
Absolutely. Being away. So first of all, getting away from that stress. I had new stress because I didn't have an exact plan at first. And, then the thought of, I'm not really had no experience as an entrepreneur before opening my own business,
Mhm.
but I do have a coach who's helping me with that, and he's fabulous. And so, I found that like learning, we're physicians, we're always learning. And so, but learning some really new stuff has been exciting. And then, finding experts to help you in things you don't know. Like I was an
Mhm.
expert for a long time in what I was doing. I didn't need, I mean, yes, I would go to shoulder courses and this and that, do our CME and whatnot, but I felt like, I was the expert there. And so now I'm not, and that's fine. But then I need to find the experts to like help me, make this next step. And it's been really exhilarating. Like it's been amazing. And I found some just great support, met some, great new people. And, I got a trainer. And even though I have a dance schedule that I stick to, I was able to, incorporate more strength training. I was able to incorporate, hormones and a little bit of peptides. And I start to do things. And I'm like, okay,
Yeah.
I'm a new
There's
person.
really
I'm
so
a new
much.
person.
Yeah, and it's,
So,
I think it's exciting and to that point, just recently, the FDA has removed the
yep,
black box warning
yep, it's
on
incredible.
estrogen, which
Hmm.
I think is, very long in coming.
Yes, yes.
I think, we trained during the transition when, hormone replacement was more common and a lot of women were on it, and especially, when we're treating those osteoporotic fractures.
Mhm. Yep.
And if someone and also we were battling a generation that went through total hysterectomy and ovarectomy. So you've got these women who go through a premature menopause
Yes. Hmm.
and now they're in their 60s, 70s, 80s, and they've been osteoporotic since their 30s or so.
Yep. Hmm.
And the number of hip fractures, when I was, we rotated through Abington out in Philly.
Yeah, yeah, yeah.
Um, and the population out there, all day long you were doing hip fractures all
Yeah.
day long.
Yeah, same. I mean, that's what I left. I mean, that was the most common. So I'm in, our hospital it became a Penn hospital, but we're out here in Westchester. And yeah, I mean, we're a community hospital. We weren't, excuse me, we're not like a trauma center, but nonetheless, I mean, what we were getting constantly was, the hip fractures, certainly some, proximal humerus fractures, distal radius fractures thrown in
Yeah.
there. But, yeah. So sorry about that. So yeah, it was, but that was, I mean, you couldn't escape a weekend on call without,
Yeah, and probably, 3 to 1
women.
female to male. And I said, as that, then they took away the estrogen.
Mhm.
Um, some of the other medicines helped a little bit, like the Fosamax and some
Yeah.
of the,
Mhm.
anti-osteoporotic
Right.
medications,
Right.
but they don't, it's never 100%.
Mhm.
They may maintain your bone density,
Yeah.
um, but
Mhm.
it's not going to increase your density to
Yeah.
pre-menopause levels or
Right.
into your
Right.
30s.
Mhm.
Um, so yeah, so I think that's, I think women are going to benefit from that a lot,
Yeah.
but it's not something you just go on when you're in your 60s or 70s. You need to start,
Yeah. I mean, ideally,
depending on, a little,
yeah.
as soon as menopause is starting. So that'll
Yeah.
be that'll be exciting for you to kind of get in on the ground floor with a lot of that.
Mhm. Yeah, it's great. I mean, there was huge discussion, especially at this conference that I was just at, about that whole like decade or so of perimenopause, prior to
Mhm.
actually entering menopause and how important it is to really get things started then, and that could include even starting some estrogen and, estrogen, progesterone, whatever your hormone replacement, therapy or hormone therapy periods. They're sometimes taking that replacement out even and just calling it hormone therapy.
Yeah.
And that or in conjunction with other lifestyle changes too, or other lifestyle modifications, let's say, and to your point, also with nutrition and strength training and all of the things that would be ideal to start earlier on, to set yourself up for that better aging process and hopefully be able to prevent the statistic I think is 70% of all hip fractures are in females, and we all know what kind of a decline that can bring afterward too, so yeah, so I think, yeah, this kind of movement, I think, is obviously long overdue and very much needed and super exciting, and they
Mhm.
also made a point, that it's never too late. I mean, certainly it's better started sooner, and hopefully that will be
Right.
the trend now. But, even if you are in your 60s, even if you're menopausal for 10 years, it's still worthwhile, looking into it and, potentially getting started. The benefits, of estrogen alone, not only for bone health, but cardiovascular health. And like, I mean, there's receptors everywhere. I mean, it's much more of a, full body, type thing. And I think that, yeah, I mean, it'll be exciting to see what happens over the next, several years.
Yeah, I said it's been very interesting for me as well, and it's nice to have that spark of learning new things for me at
Yes.
least. You know what I mean? Like you get to the point that
Mhm.
with orthopedics, if it's broke, fix it. If it's degenerated, replace it. There's it's
Yeah,
if then knee jerk reaction a lot of times. Do you want surgery? Do you not want surgery? There's you
right.
know a duality to a lot of our thinking,
Yeah.
but this is, my brain is all, I enjoyed those things in medical school. I
Mhm.
enjoyed
Yeah.
physiology. I enjoyed, endocrinology.
Yeah.
But then you get so focused and that's where they want you and, run, Forrest, run. You just go, you don't really, they don't want you thinking. They just want you
Yeah.
working.
No,
Um,
exactly. Yeah, I
and
agree with that.
I went the men's health way just
Yeah,
because, it was something that I thought was very underrepresented.
absolutely. Yeah.
One of it because, men are, you know, I love them, but a lot of times just we're knuckleheads. I'm a knucklehead sometimes,
Yeah.
especially when it comes to our health.
Mhm.
Um, it's not something we want to say, oh, yeah, oh, I've got a pain.
Yeah,
I'm having a
exactly.
cramp. Guys
Hmm.
don't,
Yeah.
just suck it up, buttercup, and move along.
Mhm.
And also, then men's mental health.
Sure.
You
Yeah.
know, you're not going to talk about that. But
Yeah.
when you start seeing the suicide rate, and I'm sure you in
Mhm.
your career, I mean, I know me, I could over the years, I've got a number of colleagues, physician suicide is high, male suicide
Absolutely.
is high.
Yeah.
I was served in the military as well.
Mhm.
Um, so all these groups,
Mhm.
and it's just a darn shame,
Yeah.
because these guys, the ones that the friends and colleagues that I've lost over the years, I
Mhm.
always say it's the one you never think of.
Yeah.
The guy that everyone goes to,
Mhm.
um, they're the leader, they're the rock,
Mhm.
they're the keystone a lot of times. But um, if they struggle with something, where do they go? And I think that's,
Mhm.
so I kind of at least wanted to start off
Yeah.
serving the men and trying to get the men to come in because they don't come in unless their spouse is dragging them by their
Right.
ear,
Right.
or significant other.
Mhm.
Um, but I do hope to, once I get this a little, I do hope to, expand it, as you
Great.
say. I think there's,
Yeah. Yeah.
because it's, the
Mhm.
hormone replacement, it's almost like, antithetic to the way, medicine has been going.
Yeah.
It's
Mhm.
you're looking for this dart, this magic bullet,
Mhm.
that
Right.
has no side effects, that has just
Yeah.
complete,
Yeah.
physiologic
Yeah.
function to do
Yeah.
what it is you're trying to do.
Right.
Whereas hormonal is more of an Eastern medicine type thing. It's,
Yeah.
for all that ails you. It's,
Right.
it'll help
Yeah.
your bone, it'll help your
Yeah.
skin, it'll help your cardiac function. And
Yeah.
that's interesting. And you do realize that you do need colleagues and friends and help,
Mhm.
um, you know, you start going deep into your medical school yearbook, and who do
Mhm.
I know who's a good rheumatologist, who's a good endocrinologist, who's a good
Mhm.
urologist. So I'm sure you're going through a lot of that as well.
Yep, for sure. And it's been nice to be exposed to some of the like the leaders in the field. I've been able to connect with at a few different meetings, in-person meetings that I've gone to. I mean, I've done a lot of education online, but gone to a few meetings in New York, went to this one in Florida, and it's just such a nice community of people too. I mean, not that ortho isn't. I mean, I love my ortho bros and then the few ortho
Yeah.
gals that I know. I mean, I think we're a great community too, but it's been a very it's been very uplifting, and people are, again, like super excited about, this kind of, again, like movement is the best way I can describe it. And yeah, for sure. Like, you get to a point, and I was, always happy to learn more in ortho, but like you said, we kind of, it's a little, I mean, there's a lot, but a lot of it is more cut and dry, particularly when you're a subspecialist. It's like, okay, I mean, I did like 8 to 10 different procedures all the time. And, and yes, I made some changes along the way, but, you have your, kind of cookbook stuff that you do, and it works, for most of your
Hmm.
patients, and that's that. And when you have your 10-minute appointment slots and you're doing 8 to 10 cases a day, and you're just wanting to like be good and efficient at what you do, and then your blinders are on, and you serve that purpose. And I'm glad to have served that purpose for the years that I did. But and I was like, maybe do I not want to like not operate? Do I want to get out of the OR and be done operating? And I couldn't answer that question at first. I thought, I'm a surgeon. I identify, that's my identity. And I realized it really wasn't. It's being a physician. It's helping people. I used
Yeah.
that specialized skill set for a long time. If I don't ever go back to it, I've come to the point where I think that's fine, because I'm so excited about what I'm learning and doing now. And I see it as, number one, a great way to help people in a more, again, kind of complete way. And number two, a way to have a little bit better lifestyle myself, which I
Yeah.
think, again, at this stage of my career, that's kind of, I mean, that is what I want. And, I have, like I said, I have two grown daughters. They don't live, one lives halfway across the country. The other one lives all the way across the country. It may not stay that way forever, but nonetheless, I'm trying to travel. We're trying to see each other. And then I have a hobby, a passion. I do ballroom dancing, and I travel with that. And, I want to be able to do more of it. So I
Well,
think
that's great
this allows for
that
that.
you're able to keep doing that.
Yeah,
Yeah, I
yeah,
mean that's fantastic.
exactly.
For you to take care of yourself. I mean, that's the hardest thing that we have spending time on ourselves.
Yeah.
You
And
know,
and I
so
think,
that's difficult.
yeah. And there's this guilt factor that comes with it, though. I mean, I don't know if you feel that or have felt that. I'm sure you have. Like, but when I, over the first even month or two that I left, I mean, a lot of my patients had my contact info. I willingly gave it out, cell phone, whatever. And a lot of people, reached out to me. I reached out to them too, because I mean, I stopped operating, I think 2 months before I left, roughly, but I still had a lot of patients who were technically in their like post-op period. And while they could go in and see one of my partners, he was already, we had one other, sports partner, but he was already super busy. So like I gave them my phone. I was like, call me, like, and I'll check in with you and just make sure that, things
Yeah,
are going as they should. And people really value that. And then, what, like I had some great conversations with people, and, just, I mean, I enjoy doing that in the office too, but there's only so much time, and
right.
being able to connect with people. And even if it's just chit chatting about, their life, or they would get me on the phone and they might ask me about other issues that were going on. I mean, in the office, it'd be like shoulder, knee, like that's, if someone tried to talk about something else, I'd be like, oh, I'll try, but I don't really have time, or we don't have a referral for that, or whatever. So the opportunity then to like, be, again, kind of just a little bit more relaxed, and take the time that it
Yeah.
takes to really help someone in the proper way, it just makes me feel better too. And it's like, a kind of, I don't know, just a little more calm. And that's
Yeah,
not what
and
life is,
I
yeah,
think you do have the opportunity to give people a little more good advice.
yeah,
I
yeah.
said when you're in the when you're in the in the heat of the fight,
Mhm.
you're in the middle of the illness
Yeah. Hmm.
program.
Yeah.
It's
Yeah.
an illness model.
Mhm.
You've
Yeah.
got you've got carpal tunnel. You've got a diagnosis that has it's a reflex.
Right.
Whereas I find that you can talk to people about their weight.
Hmm.
It's like my knees hurt.
Yeah.
Well, you're 300 pounds,
Yeah.
and you graduated at
Yeah.
184.
Right.
Um, let's get to the reason why,
Mhm.
why do you think your knees hurt?
Right.
Well, I played baseball in college. Like, yeah, but you don't think that extra 100 pounds?
Yeah.
And I
Exactly.
mean, unfortunately, people don't like to have those conversations.
Yeah.
but you're right. You need to get, the
Yeah.
population of patients that you're treating have
Mhm.
to be self-motivated.
Yeah.
But they also have to, be able to afford some of the treatments.
Sure. Absolutely.
And a lot of times with insurances won't cover these things. They won't, so you can't really talk to them
Yeah.
about the things that they really need. You
Yeah.
can't talk to them about what the real cause of this is.
Yeah.
Um, insurances aren't going
Yeah.
to cover it.
Yeah.
So I like that aspect of it. You don't feel as, hamstrung or handcuffed into
Mhm.
following the protocol that the insurance company requires, sending people to therapy when you know it's not going to work. You end up playing this insurance company game that,
Yep.
over time, I think, at least with me, it eroded your soul. It
Oh,
erodes your,
sure.
so they always we talked about this with Todd Otten. We had him on the
Yeah.
program.
Mhm.
And that difference, and they blame it on you. Well, you're burning out. It's your burnout. You need to smell more lavender candles at night.
Yeah.
You need to go to a yoga class once a month. They blame you for this burnout, but
Yeah.
really it is a lot of times it's a moral injury.
Yes.
That you've
Mhm.
been, you've been taught to do the best for the patient. We grew up in that generation where, it's you're like a priest. It's not a job, it's a profession. It's something that,
Mhm.
it's your being, it's your
Important that.
essence.
Yeah. Mhm.
And when you're forced to sacrifice your
Mhm.
morality,
Mhm.
your beliefs, suddenly you can't have your own beliefs. You can't be interested in glutathione or
Right.
NAD. You can't even talk about stuff like that in the office.
Right.
Whereas in a more of a wellness model,
Mhm.
that there's so many people, like I said, the person with the finger that
Yeah.
can't lift their arm,
Yeah.
that's an orthopedic problem that needs to be in the illness system.
Right. Right.
Patients that are in this, I just don't feel well. I've got brain fog.
Uh-huh.
That's in the wellness industry,
Right. Right.
and
Yeah.
it's teaching and educating patients that, because I still do office-based orthopedics,
Yeah.
working with the
Yep.
practice.
Yep.
And I enjoy that,
Yep.
but it's like I need to switch my hats when I
Yeah.
go from one to the other. It's like, well,
Mhm.
you're non-surgical.
Yep.
And then, but you don't really have the ability to talk to them
Mhm.
about these options, these alternative treatments
Right.
in the practice
Right.
situation.
Right.
It's like you are more of a wellness patient, not an illness patient.
Yep.
But I like that transition. It sounds like you do as well.
Yeah, I mean, I can't wait to officially get started. So hoping
Mhm.
that, like early next year, January, February is kind of our goal for getting started. And, I already have like some, friends and then other like, former patients who have kind of reached out and stayed in touch and are, curious about what I will be doing. And I'm, explained it. And I have so many people who are like, I'll be, let me know. I'll be right there. I'll be your first. I've had, 50 people tell me they're going to be my first patient, So,
Yeah, great.
people are excited about it. And I mean, people understand. I mean, a lot of people, at least, I'm everywhere, but, certainly in my region here too, even as in my last couple of years or even more in practice, people are so frustrated with the insurance companies, so frustrated with, everything as, as a patient. I mean, we're frustrated as physicians, they're frustrated as patients. And, many people are, kind of willing. I mean, I see like there's a huge population of like direct pay concierge, PCPs, primary care docs in our area here. Lots of my patients, went to, a concierge or direct pay primary care. And they loved it so much. They're like, people, again, not everybody would have the means to do maybe everything they want to do from a wellness standpoint or a direct pay standpoint, but those who do, and it's a shame that it has to, somewhat come down to that. But nonetheless, those that do have been just, they've just loved it. And people were, kind of just starved for that. Like so many patients, like, again, to the best of my ability, I try to take time with people and they would often say to me, like, like, thank you for listening to me. Like, even if I couldn't, offer too much else beyond my standard orthopedic stuff, they would be happy just to be heard. And so many people were feeling like, my doctor's just, in and out, like they don't even sit down. They don't have, and to some degree they understood. They're like, I get it. Like they don't have time.
Yeah, they've been
They've been
trained. They've
trained.
been conditioned,
Exactly. But
to be that
but
way.
some people, I think people in general, are just like starved for like having a physician that will listen to them and that will like really try to like work with them. And I feel like, that's what we were then able to do in this setting. And like I can't wait because, I tried to the best of my ability when I could in the other setting, but it's increasingly frustrating. And so, and you just, you
And
kind of
so many patients are doing their own research, and you know
absolutely. Yeah.
you've got got, Dave Asbury, you've got all these, these guys out there
Mhm.
that are, they're not lying. I mean,
Yeah,
sometimes they
there, yeah, yeah,
push
yeah.
the envelope a little bit on what's possible and what's out there, but patients are seeing it, patients are educated, and
Mhm.
you come to an office, you go to a hospital,
Yeah.
it's like that doesn't exist.
Mhm.
Like some of these things don't exist, but patients want that. They want to have access. They want information on it
Yeah.
that is somewhat honest or alternatives or someone who has an experience with it.
Yeah.
So, same thing. I've enjoyed the transition. I think it's needed. I'm glad to see that you're
Yeah.
as enthusiastic as I
Yeah.
am about it.
Absolutely. Yeah. Mhm.
So it's great. So I don't need to keep you here too much longer, but
It's
um,
great.
I'd love to, keep track of you and
Yeah.
see and get on some, hopefully see you at some conferences or what
Yeah.
have you. And,
Yeah. Sounds great.
definitely rooting for you. And I hope
Thank you. Thank you.
anything we can do for you, just
Thank you.
let us know.
That's
So
awesome.
how would people get a hold of you? What do you have a
So,
website yet
yeah,
or anything like
so
that?
the website's not up yet, but soon. It's under construction, almost done. I mean, I'm a pretty constant, pretty every day on LinkedIn. So that's probably my biggest, kind of quote unquote social media platform, if you will. I mean, I'm on the others, but just my name, Adrian Towson, is, my profile on LinkedIn. And then my clinic is just going to be the Towson Clinic. So it'll be here in Westchester, Pennsylvania. And pretty soon, like I said, we'll have a website which I'll link to, my LinkedIn page. But I'd say I'm most consistently on LinkedIn and share a lot there and starting to share about my life and share about this transition too. So yeah.
Yeah. And I've been following you, so I appreciate it. And I enjoy your
Yeah,
content
thanks.
and
Yeah.
everything. So,
So
well,
yeah,
thank you so much.
yeah,
As I
thank
said,
you.
just reach out or if you need anything, and I'm sure we'll
Okay.
stay in touch and go from
Sounds
there.
great. Sounds great. Thanks
But
for having me.
oh, you're welcome. So
All
thank you. This has been another episode of the Ultimate Men's Movement brought to you by the Ultimate Men's Clinic. I'm Dr. Jack Rocco, your host. Thank you for joining.